Hi, this video is the hair transplant surgery we will do, and this is day one. We're gonna before we start surgery, and this client actually had an FUE done in another country and with poor density. So today we're gonna try to talk about the artistry of the hairline, and then this client is nice enough to be willing to come back for us to do a follow-up, and so then that way we can track his progress and all this stuff. So the most important thing is from the mid eyebrow to the hairline. For Asian and black it's around 6.5 to 7. For Caucasian it's around 7.5 to 8.5. And then the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. So this patient, his hairline is his facial structure is somewhere in between. Again, what's unique about my work is not just the surgical skill, but there's the whole artistry of creating hairline. And I do a custom work, and I build around the facial structure of an individual to make sure it's natural for them. And of course, I take into consideration of what's the patient desire to the type of hairline. So we incorporate all that just to give them the hairline that they'd be happy with. The main idea is you want to make it natural, and that's proportional. When it's proportional, from a third and a third and a third, it frames the face better, and they draw attention away from the hairline, because then you don't really pay attention to the hairline when it frames the face better. But when you do the hairline too high, it draws attention because you have hair, but then it draws attention because you have a big giant forehead. Likewise, if you do it too low and you don't have much of forehead, then of course it draws attention. But when you do it natural and it's perfect, and it's the key word is proportional, vertically and horizontally as well, then it doesn't draw attention to your hairline. And then that's when you frame the hairline better, the face better. And when the hairline frames the face better, it really enhances the eyes, the nose, and all the features that God created. And for him, I brought in his temple too. So it's around, from the mid eyebrow to the temple, it's around 7 to 9 centimeter. If you stay within that range, then you're in a good shape. But if you do, above 9, then the forehead is too wide. And of course, for Caucasian, it's more acute backward. The Asian is a little bit less, and black is perpendicular. And for women, it's different. And then once we get the shape down, of course, we have to talk about the zigzag. There's 4 types. On 2 extreme, there's a soft hairline, which is for a conservative personality, where you more older gentlemen, where they don't want to draw attention to you, but the drawback is the density is sacrificed, so it's less dense. Where the tight hairline goes more for celebrity. For client that I do who walk the red carpet, or who's in front of TV and in front of people a lot on the camera, they want to say, hey, look at me, I have beautiful hair, I have a tight hairline, so it draws attention to you, and it give you the most density, but it draws a lot of attention to the hairline. But that's on 2 extreme spectrum. But the most majority, they offer the medium and medium tight. Now what's the difference? The medium tight has a medium zigzag, where the tight hairline has very small zigzag. And so then it say, hey, I want more density than the soft hairline, but I don't want to draw attention. And then the medium tight is in between the tight and the medium, and that's kind of push the envelope a little bit more for density, and without drawing much attention. So that's where the 2 most popular, the medium and medium tight. And once we get and that's you decide, and I can help cater around that. And then after that, we talk about transplant the hair at a very precise angle, so I'm 35, 45 in the front, and increase when you go backward, and changes when you go different. Well, those are for Asian and Caucasian, but for black it's around 15 degrees, and so it's very tight and hug on the scalp. And not just the angle is different, but the selection of hair graft is different. We transplant rows and rows of single hair graft in the front, followed by root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this client is kind enough for allowing me to show at least his head for the video. And he's a class 5 hair loss pattern. He's pretty much done from the front to the back, and he's willing to come back for us to do some follow-up progress and all this stuff. And you can see his face different, and hopefully I can convince him by maybe a year that to show his full face. That'd be awesome. Oh, until then, stay tuned.